Welcome and thank you for joining us. As a reminder, we have you muted for our initial briefing. Once the briefing is finished, you can use the Zoom application to either raise your hand for a question or you can type your question in the chat. If you've called in via phone only, you can use *9 to raise your hand. In addition, please make sure to identify yourself by your full name and the organization or media outlet you are from prior to asking your questions. With that, I'll turn it over to County Manager Mike Callagy.
Denise, thank you very much, and welcome to the Monday, April 13th briefing. We start with the numbers like I usually do. Saturday, we're at 691, Sunday, 698, and Monday, 701. So you can see the numbers have not gone up much. And again, I think it's a combination of the testing capabilities and those that we have outstanding, and the fact that shelter in place is working. And we'll talk a little bit about that in a minute. Just on the model numbers, we go to the next one. Thank you, Denise. You can see, good news is that we've got it down to 72. I think it was 89 the last time we chatted on Friday. As far as those hospitalized, it's down to 72. We got 75% of our surge beds available, 76% of the ventilators available. We've got another 150 ventilators coming, I believe, in early June to really bolster our capabilities there. And then ICU beds available, we've got 46%, which is good. Which is very good. As you can, I think many of you already know that Dr. Morrow, our health officer, has put out another statement and has indicated that by all accounts, that there's been extraordinary adherence to the shelter in place. And when you talk about, the public asking what they can do, they are clearly doing their part by sheltering in place and staying at home, and that is saving lives and preventing people from getting sick, and the lives that they are saving could be their loved ones. They're that are more senior, or the grandparents in the family, and grandfather, grandmother, aunts, uncles, all those folks that fall into that category of high risk. They are having a profound impact on, as you saw in Dr. Morrow's statement also. That there's really a trade-off that he's trying to strike here, and we'll talk a little bit about that with the modeling in a minute, between making sure that we have the capacity to treat those who need treatment in regard to COVID-19 in a herd immunity type of situation, while making sure that the hospitals and health centers are not overwhelmed with patients, and our resources are not overwhelmed. So it is a way to slowly unwind what we've done. It appears that Governor Newsom's coming out with some information tomorrow on the reopening of society, not necessarily a date, but maybe about how to go about doing that. We are also looking at that, what makes sense. So how do you do that in a informed way that doesn't set us back from the great strides that we've made to today? So that's what he'll be working on, as long as, and we will be working on also. But you can also see in his statement that, there's probably, 15 to 25,000 people all over the county and in every community that are probably infected. But without the SIP, that we would have could have well been over 50 to 75,000 now. So that is amazing. So let's go to the model real quick and show you what health has come up with, and I'll turn it over to Peter Shee from health, who can really talk to the issue. But you can see the darker colored one there. I don't know if it's a green or gray or what it is, but it's really at if there was zero reduction in social contact, if we had just stayed the course and let people get infected without shutting down society, we would have been at peak over 5,000 cases away. So you think about coming up on one side, that would have been every day getting close to that number, with incredible amounts of people utilizing hospital services, and then at the peak that much in that one day. This would have certainly overwhelmed, really overwhelmed our health system here in San Mateo County, to the point it would have been in Italy or New York or something along those lines, where we just would not have had the capacity to deal with the COVID cases alone, not to mention all those who might have a heart attack or a stroke or in need of critical care services or services at a hospital. If we had reduced it to 35% reduction, that would have led to a peak of 2,500. And again, that would not have, we would not have had the capacity to deal with that on the way up and certainly on the way down at the peak. So by doing their part, and you can see from here, certainly it's not as sharp, but it's greatly reduced, but it's prolonged. And what that does, it allows us to catch up with resources. It's allowed us the time to put more resources in place and to get those ready and to have excess resources even if we need them, because we don't know what the numbers will look like. But again, I just want to stress that, you know, it looks like we're at 65% reduction in social contact right now, and I just want to give credit to everyone out there in our communities throughout this county who are adhering to the orders and taking them seriously and sacrificing. And this is a sacrifice for everyone to stay at home and be away from your friends, your family members, your job, and the suffering that's going on financially and everything else. But this, make no mistake about it, is saving lives and reducing the amount of people that are sick. So I just want to give credit to all those in the county who are adhering to it. I say keep going. Let's see this thing through, and things will get back to normal. The question is when that will be, and that remains to be seen, because it is that dance that has to take place between those getting sick. And when you reopen a society, obviously more people will get sick, but maybe there's more tolerance there. You can see at our peak now, we'd be at 275 beds. We can manage that in this county. But it's that dance of when do you open it up? How much do you open up? How many people are going to sick? How much availability do you have of healthcare? And again, it's more of an art than a science. And just want to also say that they've done a wonderful job on modeling this in this county. I don't know if any other county has this to this level. Certainly we saw what the state had the other day, and the state as a whole said that the peak would be today. But there's different areas of the state, and we have no idea what part they were talking about, but every part is going to be different. So maybe that was the average of the state. But I'll let Peter talk to our peak in a second here. But again, I just want to give health all the credit for staying up night and day and working on this and trying to get the best information they can. But it's not perfect, and there's no model that's perfect. And you can see the models are all over the place talking about different things. But this is as a moment in time, as a snapshot in time. This is where we are right now. That could change tomorrow. That could change after they talk to all the hospitals and find out the availability of beds that they have. And we expect it to change, and good, and maybe the other way if we get more information in. So it will change over time. I just want to make sure that you're aware of that. And I'll turn it over to Peter Shee to maybe update you a little bit more on it.
Thank you, Mr. Callagy. Thanks for being clear about the process of the modeling. Our EPI team has worked really hard to use both models, Stanford model and the CHIME or UPenn model. And clearly we have flattened the curve, and the shelter in place has made dramatic and immediate impact to our ability to handle the surge. In both models, at the peak, we are able to handle the ICU bed requirements, the med-surg bed requirements, and the amount of ventilators that we would need to handle the surge. So the EOC has worked really hard to work through that process. If you look at the model for Stanford, at the end of May, we'll hit the surge. And with the CHIME model, sometime over the summer. And again, these models are with the data you put in at a snapshot in time. And the good news for San Mateo County, and with both models, we are going to be fine in responding. We are working really hard with our community to make sure that the information that is being fed to us every week is inputted and vetted. And so we believe that we have the capacity to handle any surge that's coming on both models. And so we look forward to continuing to work with our community to balance and have that dance of social distancing, shelter in place, and then also looking at helping the economy recover.
And there's so much bad news everyone reads every day and hears on the news every day about COVID-19. But I just want to stress again, how pleased we are, and we want to give all the credit to those folks out there who have adhered to the orders and who have changed the curve on this peak considerably. And you can see where we would have been again to where we are now, how they've changed that and reduced that by doing the right thing and sheltering in place. And again, at great expense to many people, both socially and financially. But it couldn't have been done without them. And it's paying off. And I just want to make sure that they understand that it is in fact paying off. And it was not, it's just a great thing to see. And we'll keep you updated on that. Okay, on to, and thank you, Peter, for all that you and your staff have done on this also. So in regard to Verily and loosening the criteria, they did have a conversation with the state, and I understand it went well. The state is amenable to that, but it comes down to the supply chain again in regard to test kits that Verily will be looking to establish their own supply chain. And I just want to emphasize that it's not the county that runs this site; it's the state working with Google, Verily, who run this site, and we just really appreciate all they're doing, being in town, being in the county. They're the only free site in the county that I'm aware of, and they do just a wonderful job. They're had volunteers out there doing this for them in the company, and we just want to thank them so much, and all that Google's done for San Mateo County also. The COVID testing transportation service reminder that that is in effect. It's you can call the EOC from 9 a.m. to 5, Monday through Friday, and set that up. We understand that there's been a lot of interest in the press in that, and thank you for getting that message out. Again, 650-779-9375 is the number, and we really appreciate that. AMR, the transport, the numbers are still holding pretty steady as to where they were before. They're under capacity by a lot. It's picked up a little bit since Friday, but still from a year to date last year, they are way under. Just to note, because life does go on outside COVID-19 on the census, we really need people to step up now, because in the midst of all this, we have got to make sure that we get these census numbers in. And we're at 56.2%. I believe that's second in the state, just behind Santa Clara at 57%. And well above California, which is showing an average of 47.2. So we don't want to lose sight of this. It is very important to all of us, and we do have many areas that are performing very well in the count, but vulnerable communities, especially vulnerable communities, need to make sure that we have their voice heard, that we count them, and we do have a low response rate in those more vulnerable areas of the county. So even working with Second Harvest Food Bank, we're trying to get that word out with census material and into the 15,000 pre-packed food boxes every week, and that they're getting out there. So that's very important. COVID homeless shelter update. We've been able to decrease the amount we had on the waiting list considerably. We're up at 77 on the waiting list for homeless shelter. We got that down to 38 now, and in large part because of 20 beds we brought on at the shelter at the Maple Street, and then 10 at We Hope in East Palo Alto. We are looking for other opportunities, working with health to get more vulnerable off the street and into motels. And out of the shelter and into motels where they can have more of an opportunity to shelter in place and stay away from other people if they're vulnerable. So that'll be the focus of this week, on making sure that we acquire more motel rooms and get them off the street. Volunteers, we've got a new website coming on board for volunteers, and that'll be up and running today or tomorrow, which will match volunteers with the services that they would like to be involved in. So the nonprofits will be able to come up, and then the volunteers will be able to make sure that they match their own interests with that. And the last Friday, SMC volunteers donated hand-sewn masks for San Mateo County Human Services Agency to help our homeless community. So I think it was awesome. They've also, and the volunteers have just been terrific in this county, stepping up. We got 1,700 of them now that are stepping up, and you can see here writing notes to our seniors from Meals on Wheels, and it's going in their care packs there, just to know that there are people thinking of them, and there are people caring that do care about them, even though they may be in isolation and somewhat lonely right now. We do have, I have named the Director of Libraries, Anne-Marie Despain, to be really kind of the food czar for us in the county, where she will interact with Second Harvest Food Bank to make sure that the food supplies are working in this county, to oversee that they're working in this county. Second Harvest has done a fantastic job. We're so appreciative of all their hard work. They're putting boxes to food together faster than ever, getting it out to the communities. Demand is higher than it's ever been before, but they have done a fantastic job. And Anna Marie will work with the cities to make sure that we're meeting all of their needs and making sure that we get out information on where those food services will be, that we continually check up on them and make sure that the supplies are okay and that they are well funded. So let me go to some of the questions real quick submitted that were submitted on Friday. On Friday, you mentioned the widening the criteria for testing. Is that moving ahead? And if not, why is it stopping? What's stopping it? It's really, like I just said earlier, the supply chain is really the issue. And Google will, Verily will be working on that supply chain, but potentially creating their own supply chain instead of going through the state on that. Again, we're just so appreciative of them being in the county, working on that. They are trying to expand, and we will continue to support them any way we can. The data on the county's health side is becoming more robust. Thank you. Is that coming in-house or from the state? It's coming in-house. And I got to tell you, it's Peter and his staff, the epidemiologists and everyone else working on this night and day. And it's only going to get more robust. We want to get ethnicity in there if we can, but we are limited. And I understand there's people who want more information, and we're limited by the amount of information that we're getting. So whatever we're getting, we're trying to put in a meaningful way to the public and getting that information out there. We believe in transparency. We want to get out all the information we can. I just want to say that will continue to get better as time goes on. And now that they have, they've been working night and day on the modeling. Now that they have some of the modeling done. And again, I just want to go back to the modeling and just reiterate that don't read anything into this as to when we will reopen. It's just, it's a model. It's information. I guess the best part of it, it shows that what we're doing is working, and that we do have enough beds and ventilators and ICU units available right now, and that is great news. And I just want to again thank the public for all their work on that. Did the recent low numbers of cases follow the current modeling? Well, we know that it would have been a lot more had we not been doing what we were doing. The numbers would have been much higher. And we're talking about hospitalizations. If we had done nothing, over 5,000 a day at the peak. But every day would have been extremely high and wouldn't have allowed us the opportunity to treat those patients. A lot more people would have died. Certainly, ventilators wouldn't have been available. ICU beds wouldn't be available. That is a reflection of all the great work the public is doing. Is today the peak or Wednesday? The model from Washington, I believe it was Washington, showed the peak today, but for California, not specific to our region. This is specific to our county. Very unusual and very in depth. And there will be other models coming out of the state probably, per county. They could differ. They may be the same. This is again, this is not an exact science. There's a lot of factors that go into this, and those factors change daily. So we will continue to update as we can. And is there any progress on plans to reopen society, and in what way? Clearly from Dr. Morrow's message, it will be a gradual reopening. It will not be a light switch type of reopening. It'll be well thought out. It'll be strategic. What we don't want to do is rebound back to that point where we have mass folks in this county in need of hospitalization or ventilators that we cannot accommodate. We'll do it in a strategic way to try to balance that the need to reopen an economy and get back to as normal as we can, while also making sure that we don't overwhelm our health system. We're in a really good position right now. We do not want to compromise that. So, but we all do want to get society back open and get things going again. So we will do it in a meaningful way, in a strategic way, in a way that protects lives, while also understanding that there's an economic price to pay on this, and we want to get the economy going again. Okay, with that.
There are no questions.
There are no questions.
Or raised hands.
No raised hands, no questions.
Yes, there are.
Okay.
I have a question.
Please.
Oh, you can hear me. Okay, thank you. Two things. One, could you put the slide up, the initial slide with the statistics? And two, you had mentioned herd immunity. And it's my understanding you don't really have herd immunity until you have 95% of the people, I think, who are immunized or who've already had, who have some type of immunity.
Yeah, I think what that is really 70 to 80 when you talk about herd immunity with the disease then being really dying out on its own, and certainly this is the case in other epidemics that have taken place in history. So it's 70 to 80%, and how do you do that? We don't know how many people have already been exposed, right? And I think that's where the antibody testing comes from that we talked about last time. That's going to be so important. We may have a large segment of society that has already had it, not even known it, because they were asymptomatic or they had mild symptoms. And who knows how long back it could have gone and how long it's been here. So the antibody testing will be essential to trying to get a better understanding, a better handle on how many people are immune. And then again, you know, as you open up society, if you do it in a way that is strategic, more people certainly will get infected, but they won't overwhelm our system. And I think that's the point of it. And that's if you just have herd immunity where you just expose everybody at once and say go for it, you would simply quickly overwhelm the system and a lot of people would die, though you would get over it eventually. So we're trying to do this in a strategic way. The doctor has outlined that in his latest statement. And there'll be more to come on that when really the details of that emerge.
Is there any preparation taking place right now for the possibility of a resurgence, let's say in the fall or? Yeah,
well, absolutely. I mean, so we're looking at that. You know, I think I mentioned a while back that we've got IEM as a consultant on board, and they're really looking at three phases, right? The first one is at 30, 60, 90 days out. What are we doing? What can we expect? What if we have an earthquake in the middle of this? What if we have a wildfire? So really looking at all possibilities 30, 60, 90 days out and beyond. The second phase would be how do you reopen society in a meaningful way and strategic way? We've got groups working on that. And then the third one is what do we do if there's a resurgence of this disease and we had to close down again? What do you do financially? What do you do psychologically? What do you do organizationally? What do you do medically? All those type of things, and we need to prepare now, and we're doing that as far as the PPEs and bringing additional ventilators on board and doing those things now. So because we know when you're in the middle of this, it's not the right time to try to scale up. So we are trying to make sure that we have all those scenarios thought through and ready if we in fact do have to do that. If it's right, if they do it the right way and we reach herd immunity without overwhelming the system, then there may not be a need to go back in again. But if you overwhelm it, the system, that could cause, I would imagine, another possibility of a shutdown.
Thank you.
And just so you know, you can access these statistics at the link up here, or you can just go to smchealth.org and navigate your way, and you'll have access to all of these dashboards.
Okay, thank you.
Great, and I thank you, whoever said that the road is getting more robust. I noticed that at least one site out there that's kind of judging the counties by the information they're releasing gives a lot of credit to San Mateo County. I think we were second in the Bay Area for the information. This is just one site. You can all judge for yourself where we're at, but it's really robust. They're doing a great job of getting that information out, and they were recognized for doing that from at least one site. So any other questions?
Yes, a question from Austin Walsh. If we reach the county's peak in May or later this summer, can we project how many cases that may be?
Well, it depends on the testing again.
Yeah.
So our litmus test is really our ability to support the surge with our ICU beds, ventilators, and med-surg beds. And so based on that calculation, we should be able to meet that need.
Yeah, and the hard thing to answer about that is that we don't know how many people have been infected and don't know it. But the doctor pointed out that you know, it's kind of his best guess that approximately 2 to 3% of the SMC population are currently infected and have recovered from the infection. So that's around 15,000 to 25,000. So you can maybe extrapolate that out a little bit, but you got to take into consideration the shelter in place. But clearly, had we not done what we did, it would have been 75,000 potentially that have been infected, and the system would have been simply overwhelmed. So Dr. Morrow spelled out some of that in his latest update.
I don't see any other raised hands. I guess if there's another question and you don't have your hand raised, you can unmute yourself or put it in the chat in the next few seconds. And if not, we'll go ahead and end today's briefing.
Let me just say thank you all for being here, and we will be back next Wednesday with the latest update.